Thank you. Thank you very much for the opportunity to be here today and to learn from all of the speakers. It's been such a rich discussion and so happy to have the opportunity. So while children haven't been so visible in the COVID-19 pandemic, they have been significantly impacted, and children with disabilities even more so. So at UNICEF, we've heard numerous reports of children with disabilities living in institutions, facing high levels of infection, serious complications, and even death. Children with disabilities also face increased risk of violence, exploitation, abuse, and neglect, as families and households are under increased pressure and isolated from their usual support networks. And in the context of school closures, children with disabilities who were already excluded from education are at risk of being even further left behind, as we often see that distance and remote learning programs are not accessible. So recognising this impact on children with disabilities, UNICEF has firstly produced 2 guidance notes on inclusion of children with disabilities in the COVID response. One of these guidance notes addresses access to water, sanitation and hygiene, to education, to mental health and psychosocial support, child protection and other services. The other note focuses more on persons with disabilities as actors in the response. And so it provides guidance on how to engage children and adults with disabilities as actors in response to COVID. Now with UNICEF, as was already mentioned in the introduction, I work on disability inclusive humanitarian action. And in humanitarian action, we know that emergencies present us with opportunities. As we've already heard from many of the speakers today, this crisis has forced us to rethink the way we deliver services, the way we do our work, interact with each other, and the way we protect the most vulnerable in our communities. And we're now finding that some of the changes that we've made are for the better. So at UNICEF, we're working to make sure that everything we do in response to COVID contributes to building a more inclusive society. And I'll just touch on 3 examples as briefly as possible. So firstly, the pandemic has highlighted that more than ever before, that children with disabilities face risks living in institutions. Not only high risks of infection, but also of abuse and neglect. And in a new normal, UNICEF is working on ensuring that we make a renewed commitment to ensuring that every child realises their right to grow up in a family environment and that families are properly supported in this. So in Kyrgyzstan, for example, UNICEF is working to strengthen community-based services for children with disabilities, is providing support to parents and working to address a lot of that stigma that often leads to placement of children with disabilities in institutions. Secondly, even before this crisis, children with disabilities were more than 10 times more likely to be out of school. And now we're being forced to think creatively about how to ensure that children can continue learning despite extensive school closures. So in the new normal, UNICEF is working to ensure that this creative thinking and this investment in adapted approaches to learning extend to all aspects of education. And as schools reopen, we're working to support education actors to adapt curriculums, teaching and learning materials to ensure that they're more inclusive of all children. So for example, in Uzbekistan, we've supported tools for children with disabilities and from ethnic minorities that feature sign language and multiple language subtitles. We also provide print and digital resources for parents and caregivers to help them support their children during the crisis through daily activities and tips. As UNICEF has seen, and as many families can confirm, being out of school has a huge impact on children that goes well beyond academic outcomes. Thirdly and lastly, throughout this crisis, we've also been reminded of how important access to information is. And children, thankfully, have not been forgotten. We've seen numerous examples of information being presented in child-friendly formats, and even, for example, leaders hosting press conferences for children. In UNICEF country offices, we've also seen many great examples of information being made accessible to children with disabilities through the development of accessible and child-friendly formats. So for example, in India, UNICEF produced information about COVID through videos with puppets and sign language. And this was done using local resources without even access to a basic studio setup. I personally haven't seen this level of commitment to accessible information in any other emergency that I've been involved in. And I'm hopeful that this will become the new standard and this will become the new normal. We've seen clearly throughout this crisis that it is possible, even in more challenging and resource-constrained settings, to ensure that information is always provided in accessible and child-friendly formats. So we're hopeful that this will become the standard way of doing business. Now, I've aimed to be very brief, so these are just some examples. There are many more. As UNICEF, we look forward to continuing to work with all of you to ensure that children with disabilities are no longer left behind. We need to ensure that everything we do as part of the response to the crisis contributes towards this goal, and that we realise every opportunity to build more inclusive communities and service systems. Thank you very much again for the opportunity.